The trick we have is being able to reliably detect the patients who do need treatment up front versus those who are safe to watch.
For your patients with low risk, localized prostate cancer, if you do nothing but active surveillance, you'll be doing the right thing, according to a study reported to the 2013 Genitourinary Cancers Symposium. Patients under watchful waiting had only slow changes in tumour grade over time, and 2/3 of them didn't need treatment at all, so they were spared the side effects.
By biopsying patients from time to time, we want to determine whether there is a change in the aggressiveness of the cancer that would help us identify those patients who might have disease that we didn't at first think was less well behaved. In other words, this is a patient who actually needs treatment. But it's important for us to diagnose those patients early when the patients are still curable. So what our study did was look at a group of patients at Sunnybrook. So we have almost 900 patients identified, and we followed them for up to 20 years. And we found on average about a third of patients, when we biopsy them over time, would actually have more aggressive features found on subsequent biopsies compared to the original biopsy.
So for the busy cancer doctor, what are the clinical implications of this?
Well, I think it's reassuring in a way because a third is what we see in terms of what we think is an appropriate treatment rate for patients on active surveillance programs. So I think a lot of comments that we've heard is that, you know, if you just follow those patients long enough, all patients will turn into a treatable cancer. And what we're seeing is we're not seeing that up to 20 years now. It's still only about 30%. It's still important for us to identify the 30%, but it's not 100%. So we can still spare 70% of patients from undergoing treatment and treatment-related side effects.